What your hands tell you about your leg strength when you stand up. If you're over 60, try something very simple today. Sit on a normal, stable chair. Place both feet firmly on the floor. And try to stand up without using your hands to support yourself on the armrests, the table, or your own thighs. How does that feel? Does it go smoothly? Do you have to build up momentum first? Do you lean your upper body very far forward? Or do you notice that your hands almost automatically search for support? Exactly this everyday movement can tell us a surprising amount about strength, mobility, and independence in old age. And no, if you need your hands to stand up, it doesn't automatically mean that something is wrong. And it doesn't just mean that's just old age. Often there is something behind it that is trainable. Today we're taking a look at which muscles are particularly important when standing up, why regular walking alone isn't necessarily enough, and how you can specifically train your legs. At the end, I'll also show you a simple sit-to-stand test. This test is also used in medical and scientific assessments of physical function. So stay with us until the end. Maybe afterwards you will see a movement that you do dozens of times every day with completely different eyes. And if you're new here, at Vitality 50+, we talk about how you can support your body in healthy aging. Understandable, practical, and scientifically oriented. Subscribe to the channel if you want to see content like this regularly. Let's start with an important question. Why does standing up sometimes become more difficult as we get older? When standing up, much more happens than it seems at first glance. You have to shift your upper body forward and bring your body weight over your feet. Extend your knees and hips while controlling your balance at the same time. Several muscle groups work together. A particularly important role is played by the muscles on the front of your thighs, the quadriceps. Its job is, among other things, to extend the knee. But it doesn't work alone. The gluteal muscles also help to straighten the hip. Your core muscles stabilize the upper body. Muscle teamwork in focus. And your feet and lower legs help you maintain your balance. This means standing up is not a movement of a single magical muscle. It's teamwork. Thigh strength is key. As we age, muscle mass, strength, and especially the ability to develop strength quickly can decrease. This doesn't happen overnight, but often slowly. As we age, muscle mass, strength, and especially the ability to develop strength quickly can decrease. This doesn't happen overnight, but often slowly. Maybe you continue to go shopping. Maybe you go for your walk every day. Maybe you feel basically fit, and yet you notice subtle differences. And yet you notice at some point, stairs feel more exhausting. You don't get up as easily from a deep armchair. The movement loses its lightness. When getting into the car, you need a little more support. Or you push yourself up with both hands when standing up. A classic, often overlooked sign. The interesting thing is, you can certainly still have enough endurance to walk for a long time, and still have difficulty with a short, powerful movement like standing up. Strength is the key here. Why? Because endurance and muscle strength are not the same thing. And here another term comes into play, explosive strength. The secret behind dynamic movement. Simplified, this means the ability to provide strength relatively quickly. Think of the leisurely walk versus the powerful stand-up. Your body needs to react fast. Your muscles work continuously and repeat the same movements during a walk. Now compare that to standing up from a chair. Here, you need explosiveness to move your weight upward. In a short time, you have to move your body weight forward and then upward. Or imagine you stumble slightly. Then your body has to react quickly. That's explosive strength. That's exactly why in healthy aging it's not just important to move at all. We should try to maintain different abilities. Endurance, strength, balance, coordination. And, as far as individually suitable, the ability to use strength in a controlled and speedy manner. This explains why I would never recommend that you skip your walks. Walking is excellent. It gets you moving and uses your circulation, but it's not enough on its own. Walking is a very accessible form of physical activity for many people. A great foundation. But walking and targeted strength training don't fulfill the same task. That's a key difference. If you only go for walks, your muscles may not always get the training stimulus they need to maintain certain strength abilities. This applies especially to movements like standing up, climbing stairs, or catching yourself from a stumble. You need targeted strength training, or coming back up from a deep position, and that's exactly why we're going to look at what actually happens when you stand up, and how you can train this movement. Because the decisive factor is not how old you are today. The decisive factor is which training stimulus your muscles receive regularly. And the good news is muscles react, even older muscles. Even older muscles can respond to training. In the next part, I'll show you a simple progression with several difficulty levels. We start safe and effective. We don't automatically start without hands. We start where you can move safely today. Good training means the right exercise in the right dosage. Because good training in old age doesn't mean doing the most difficult exercises. It means finding the right dosage for your success. It means doing the right exercise in the right dosage. Let's get started with your journey to stronger legs. Join us now at Vitality 50 Plus. Before we begin, all you need is a sturdy chair. Ideally, place it with the backrest against the wall so it cannot slide backward. Wear shoes that give you a secure grip and make sure there is nothing around the chair that you could trip over. If you feel unsteady while standing, have balance problems, or have fallen recently, do not perform these exercises alone. And now, we consciously begin with the simplest variant. Level 1. Standing up with support. Sit upright on the front part of the chair. Place your feet approximately hip-width apart on the floor. Now comes a detail that many people underestimate. Your feet should not be too far in front of you. Bring them a little closer to the chair so that you can shift your body weight forward more easily. The rest we will show in part 2. Now, controlledly lean your upper body forward. Imagine your chest moving towards your knees. Then push yourself up. If you need your hands for this, use them. This is not a defeat. This is your starting position. The goal of good training is not to prove what you cannot do yet. The goal is to give your body a stimulus so that a movement can become easier over time. Try to use only as much hand support as is actually necessary, then slowly sit back down. And exactly this return path is important. Do not just let yourself fall onto the chair. Try to control the movement. You can count slowly while sitting down. 1, 2, 3. Why? Because your thigh muscles also have to work during controlled lowering. In part 3, we will reduce the support. Level 2. Less support. Once the first variant works safely, you can try to gradually reduce the support of your hands. Maybe you use both hands at first, later only one, or you simply place your hands lightly on your thighs. A small difference can already mean that your legs take over a larger portion of the work. Make the movement slowly and consciously. Quality is more important than speed. Level 3. Rising without hands. If you feel safe and have sufficient strength, cross your arms loosely in front of your chest. Feet stable, torso slightly forward, then stand up. Straighten up completely. Stay standing stable for a brief moment. And then sit back down controlledly. Try 5 repetitions at first, for example. In the next part, we will increase the intensity. And now we come to a variant that is particularly interesting for many people. Level 4. Controlled faster rising. If you have mastered the previous variant safely, you can try to perform the upward movement a bit more briskly. Not jerky, not maximum speed, and never at the expense of balance. The idea is controlled brisk up, slow sit back down. This changes the training stimulus. You train power in an everyday movement. But this level is not the right start for everyone. If you have pain or feel unsteady, stay with a lighter variant for now. What can you do if you cannot stand up at all without your hands? Increase the seat surface. For example, place a firm, stable seat cushion on the chair. The higher the starting position, the shorter the movement path usually becomes. This makes standing up easier. As you get stronger, reduce the height step by step. In part 5, we show one more exercise. There is also a second exercise you can use to train your thighs without getting up from the chair. Sit upright. Both feet are initially on the floor. Now straighten one knee in a controlled manner so that your foot moves forward and up. Hold the position briefly, then slowly lower the leg again. Then switch sides. Make sure you do not lean back with your entire upper body. The movement should mainly come from the knee. How often should you train? You do not have to train to exhaustion every day. For strength training, both effort and recovery are important. Plan muscle strengthening activities on several days a week. Your personal starting situation is crucial. Remember, training does not have to be maximal to be effective, but it must be regular and properly dosed. In the next video, we will show you a simple test to measure your progress. All you need is a chair and a stopwatch. Good luck with your training.
Block 3, the sit-to-stand test and what it can really tell you. Now I'd like to show you a test that looks very simple, but is actually used in various versions to assess physical function, the so-called 5 times sit-to-stand test, often referred to internationally by this name. Before you try it out, however, please keep the following rules in mind. Only take the test if you can stand up safely without help. If you need support when standing up, have severe pain, feel dizzy, or are afraid of falling, do not take the self-test. Discuss your situation with a medical or physiotherapeutic professional if necessary. Here is how the test works and how you can perform it basically. Sit on a stable chair. Place both feet securely on the floor. If you can perform the movement safely without hands, cross your arms over your chest. Now stand up completely and sit back down again. Repeat this a total of 5 times. The time is measured. But here comes something very important. You may have already seen statements on the internet like, if you take longer than exactly X seconds, your legs are too weak. So simple is the interpretation not. Results can be influenced by age, baseline situation, chair height, and health status. A single value is therefore not a diagnosis. That's why I find another application for everyday life particularly interesting. Compare yourself with yourself. Note your result today. If you then train regularly and safely, you can repeat the test after a few weeks under as similar conditions as possible. Same chair, similar time of day, same technique. And then compare, not, am I better than other people my age? But, has my own function changed? That is often the more meaningful question in healthy aging. Because mobility doesn't mean having to achieve the same as someone else at 70. Mobility means being able to perform the movements that are important for your own life for as long as possible. Standing up from a chair alone, managing stairs, going shopping, getting out of the car, moving safely in everyday life, and staying independent as long as possible. That's exactly why leg training after 50 is not just for people who want to build muscle. It's about function, and function means quality of life. Think about how often you stand up every day. From bed, from the breakfast table, from the sofa, from the toilet, from the car seat, from a bench. Every single time your legs are working against gravity. If this movement becomes more difficult, many people unconsciously begin to avoid it. You prefer to sit on higher chairs. You use the elevator more often. You use your hands. You avoid stairs. You move more cautiously. And this can create an unfavorable cycle. Less demanding movement leads to less training stimulus. Less training stimulus can in turn contribute to a further decline in strength and physical performance. Therefore, the better strategy is often not, I'm over 50, so I have to take it easy. But, I'm over 50, so I should regularly give my body appropriate stimuli. Of course, this doesn't mean ignoring pain. It also doesn't mean doing risky exercises. And it certainly doesn't mean that every person needs the same training program. Healthy aging means adapting movement to your own situation. Perhaps your training starts with standing up 5 times with support. Maybe you can already do 10 repetitions without hands. Maybe you're already training squats regularly. All 3 people can work on their mobility. Only the starting point is different. And that's exactly the message of this video. If you need your hands when standing up, I don't automatically see that as an unchangeable sign of age. Ask yourself instead, can I train my legs specifically? Can I improve the movement step by step? Can I do something today so that my daily routine remains even easier? In a few years? Because muscles need a reason to stay strong. And that reason is load. Not overload, not pain, but regular appropriate load. Walking remains valuable. But combine movement where appropriate for you with exercises for muscle strength and balance. Healthy aging doesn't consist of a single exercise. It consists of several skills that together ensure that you can move safely and independently. And now I'm interested in something. Can you stand up from a normal chair without using your hands? Just write yes or not yet in the comments. And if you were able to perform the 5 times sit to stand test safely, you can also write down your time. Maybe test yourself again after a few weeks and compare your result. If this video helped you, subscribe to Vitality 50 Plus. In the next videos, we'll continue talking about how to strengthen your legs, improve your balance, and maintain your mobility as long as possible. The goal is not to appear younger. The goal is to be able to do what is important for your own life for as long as possible. Stay active. Important notice: this video is for general information purposes only and does not replace individual medical advice, diagnosis, or treatment. Exercises and self-tests should only be performed if you feel safe doing so. Stop if you experience pain, dizziness, or shortness of breath. If you have recently had surgery, relevant joint problems, osteoporosis, heart circulatory diseases, or other health restrictions, clarify suitable exercises with your doctor, physical therapist, or healthcare professional first.